Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and that they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Is a hospital in Risambo along Lumumba Drive. We are level 4 facility, SHA accredited.
In Africa, more than 24 million people are living with diabetes. That is according to the World Health Organization. Moreover, 50% of them don't even know it, simply undiagnosed. What does this mean? Damage often sets in before a diagnosis is made. Now, what does this mean for families? How does it impact our lives and how do we deal with it? This and much more coming up. Greetings and welcome to another episode of the Healthy You. This is your favorite health program, bringing you weekly expert health insights on Faith Today television. My name is Enock Kitondekijja, your host. A special thanks goes to JCK Hospital. Now, these are our distinguished partners. They make this program possible. We would not be here if it was not for JCK Hospital. And needless to say, JCK Hospital has made great advances since 2018. They have really touched thousands of people's lives. And now they are making an advance in the healthy sector. Their education, they are helping people fulfill their dreams. So are you passionate about becoming a healthcare giver, a caregiver? They are running what we call a healthcare assistant course from JCK Hospital College of Health Sciences. Their May June intake is ongoing right now. Use that number that is on your screen to reach them and don't miss out on this second intake. Now, bringing us today here is a very critical subject. We are talking about diabetes. It's affecting so many families, so many people. Most of them don't even know about it. And the argument is, how do we deal with diabetes in families? And to help us unpack this interesting conversation is no other but a very knowledgeable doctor, a medical officer from JCK Hospital, again, our partners. He's here to help us break it down and get it to the bottom end. But before I invite him, I'm aware we have those of you who follow us on YouTube and Facebook. You do so well. The analytical report tells me that most of you who follow us have not yet subscribed. We want to request you to please press that subscribe button, press that bell just to remind you whenever this good content is coming in. And if you're blessed by this content, feel free to share with as many people as you can. Thank you so much. Those of you who are following us, we are on Pang, and that number on your screen is what you can reach us with. So if you have any question, the earlier you do, the better. The expert is in the building to help us understand, deal with diabetes once and for all. Back to my guest, Daktari, you are welcome.
Thank you so much.
Would you please introduce yourself to our viewers?
Okay, thank you. So, my name is Dr. Emmanuel Chiro. I'm a medical officer working at JCK Hospital. Yes, and I'm a passionate educationist. I also do part-time tutorial courses and teaching at Aga Khan Hospital. Yes.
Wow, you're welcome.
Thank you.
And how has been your week like? How did your week got you?
It has been well.
Okay.
Yes, just work, quite busy, but we are doing well. Yes.
Wow, you're welcome.
Thank you so much.
And, we are talking about diabetes today. So many people are struggling, and there are those even who don't know they are having diabetes. They later just get to know when it is probably it's getting to complicate in their lives. So would you give us an overview of what diabetes is so we can start?
So sure. So diabetes is it's a chronic metabolic disease. And by that, it means it's something that once diagnosed, it's lifelong. So it's true. Most people come with complications as the first presentation at diagnosis. Yes, but again, it's good to understand like all this happens due to how the progression of the disease occurs. So broadly, there are two major types of diabetes. There's the type 1 and there's the type 2. I think for majority of our population, our case will be the type 2. And unfortunately, this is the commonest type, and it's the one that it tends to manifest at the stage where it's already having the complications. For example, you can have a patient coming with already kidney issues, with eye issues, with feet which are having wounds. So unfortunately, it's the commonest, but it's the one that can run a silent cause until the time when the patient comes with sugars that are very high and recordable. So generally, that's the type that comes. The type 1 is the one that will come with early in life, and this one tends to be of an acute onset. It happens suddenly, and they most likely seek attention even before much progression of the disease. So generally, diabetes is a common disease in our setup. As per the current statistics, for example, in 2019, we're talking of like 3% of the population having diabetes. And it's projected by the year 2035, at least 4.5 of the population will be having diabetes. And 4.5 can sound a small number, but again, taking the Kenyan population, that's taking like 4.5 of the Kenyan population, that's a huge burden to the general population and even to the patients themselves, considering it's a long-term disease that will require medication and follow-up. So generally, that's briefly about diabetes. I know there are specific issues you will want me to handle concerning diabetes, but generally to say is that diabetes is a chronic disease, and for any chronic disease, diagnosis, proper follow-up, and prevention of the complication is key. So that will apply in all the cases.
Okay.
So maybe.
Yeah, and I like the background you give, because the challenge we have today, like you've said, most of the people come in when it is in the late stages. Probably the kidneys are failing, they're getting fit that are not cured, regardless of even the treatment. Probably help us understand why so, what are the causes, and why does someone have to delay that much before they come to diagnose the diabetes itself? And you give us an understanding of why does someone have to wait for long? Is it that it's not painful? Yeah. And then when they get it, they have to treat, it's lifelong treatment. Yeah. Also want to understand what are the causes? Perhaps give us that, and then I know it will help us also broaden our understanding of this thing, diabetes.
Okay, thank you. I think it's important to understand that diabetes, the issue with diabetes is having your body, simply put, can't utilize the sugar that it's having. The food you eat, almost every food you eat, most of the food you eat, will at some point be converted to sugar, that is glucose. And the unfortunate thing about diabetes is that the body is having this sugar, but it cannot utilize it. So it remains in the blood. So that's to mean we have the symptoms that can point like could be suggestive of diabetes. For example, all of a sudden you are feeling too hungry. You are eating a lot, but again, the more you eat, the even hungrier you become. You are drinking a lot of water, but it's not enough. Every time you're going for a short call, those are the kind of the obvious symptoms of diabetes. But it's again good to note that the standard symptoms may not apply to everyone, so that you can find that you've been having persistently high sugars, but you are just doing your normal activities. So not unless you are screened for and be found that you have persistently high sugars, that's when you can be put on treatment. Then again, it's good to know that in our setup, the general population, especially in men, the health-seeking behaviors is generally low compared to ladies. So that for men, they can be having those symptoms, but then again delay. Not that it's from ignorance, but from just being African. I'm a strong person. So these are most of the people that will come later in the disease progression, having their eyes are going blind. Yes.
Yeah.
So for the causes of diabetes, I would say there is no specific one cause of diabetes. Diabetes are what we call a multifactorial disease. So many factors contribute towards the occurrence of the disease. So as I had said earlier, there are two major categories, type 1, type 2. But it's again good to note that apart from those two, there are others like gestational diabetes. It's solely occurring in pregnant women. There are other rare but small contributing causes like genetic issues, medication, especially in our setup. You can see that corticosteroids, the drugs that you use normally to reduce inflammation, reduce pain, if overused over a long time, they can cause also diabetes. So there's that genetic factor, especially for type 2 diabetes. It's good I point out that type 1, type 2 diabetes, they are different in that they occur in two different populations. Type 1 diabetes occurs largely in the young people. We generally say those less than 30 to 35 years. Yes, they're the ones that can get type 1 diabetes. Type 1 diabetes is mostly autoimmune. By autoimmune, I mean the body's immune system will attack the cells that are responsible for producing insulin. Insulin is the hormone that
Regulates the sugar.
Yes, helps you to use the sugar. Yes.
Yeah.
So that's the one that occurs in type 1. In type 2 is the one that largely I mean, it doesn't have to occur in the older population, but mostly in the older population, because nowadays it's good to know that even a 15-year-old can be diagnosed with type 2 diabetes. So it will occur in those a bit older, from 35 years onwards, and it comes with its own risk factors. One is a family history. 2 is being overweight, having a BMI more than...
Yeah.
Yes.
I think that's really answers a question that
Yes.
I'm sure very many people have been dazzling with about the question of the causes, because when you now help us understand that just mere using of these over-the-counter drugs or misusing the drugs that we get, probably you've talked about corticosteroids, it can predispose you to, diabetes. And I think that's a good background, but also help us understand now the other probably there could be lifestyle issues that can predispose one to diabetes. I know we are going to talk about type 1, in detail, but help us understand for the people who do not have a history in their family, what could really predispose them. I know you talked about drugs. What else could be lifestyle? Help us understand what are other features.
All right. So the risk factors, basically, that's what we are talking about, what can predispose to type 2 diabetes. So as you had put it correctly, lifestyle. So by lifestyle, I mean, it's a kind of life that predisposes. So a sedentary lifestyle, that's if you are less physically active, if like you are, nowadays it can be due to job demands. Maybe your job demands you to be like fixed in one place, but that lifestyle, sedentary, not exercising frequently, that's a number 1 risk. 2, I had said being overweight. By overweight, I mean a BMI more than 25. Other issues like alcohol intake, smoking of cigarettes. There are other emerging issues, what we call dyslipidemia. So basically having high cholesterol in your body. That's another risk.
Yeah. Maybe also help us understand, how do you manage diabetes? Once you have diagnosed it, what is the process? Walk us through the process of management.
So management of diabetes.
Is it like someone has to take these drugs for life until they die? What are the dynamics?
Yes and no. Yeah, so the approach on how we manage diabetes, it's not just a matter of prescribing drugs and giving it to the patient. First of all, you have to make this person understand that they're having this disease and it's a long-term disease. We can control it, but largely there's no cure. So it's something that we can control. By control, I mean there is the medicine part and there is the non-medicine part. So even how we approach it that way. The non-medicine part will include things like now changing the lifestyle which predispose to the diabetes. So by that I mean like being physically active, exercising, yes, cutting on alcohol, yes, and that brings into another issue, but I think we'll discuss it. The issue with sugars, taking sugars. Yeah. So basically that's where we start. Then from there we now discuss what we call pharmacology part, which will include the drugs. The drugs, there is not just one type of drug for diabetes. There are different categories depending on the patient's demands. There are even those we even prescribe injections, insulin injections. Yes, and so it's good to understand that once you're diagnosed with diabetes, it's important to know that it can be controlled. But even when you achieve the control, it's not a leeway to stop the medication. Yeah. Yes.
So you've talked about, and I like the way you put it, that the pharmacological part of it, it's something that someone has to take for a long time, right?
Yes.
Lifelong. And it's a challenge because when you talk also to us about it now affecting the young population, it a bit worries us that someone, imagine someone has been diagnosed at 15 years and they have to start this medication for long. Help us understand what could be the what could cause this diabetes in early? Why is it now showing up more in the younger population than it was before? I hope you understand what I'm trying to. Yeah,
I think that transition, it's because of the lifestyle change. Recently, unlike before, we're seeing the young people getting obese. Like before, it was kind of difficult to get a 15-year-old with maybe who is diabetic, because issues with weight at that age then wasn't an issue. But now you see with current technology or lifestyle changes, you can see that even these young people are getting what predisposes someone to get the diabetes. So for example, a 15-year-old, largely sedentary, yes, being overweight, then all those factors coupled with now there's a strong family history of diabetes. Now you can find even these patients, they develop diabetes.
Yeah. Thank you so much for that background. Those of you who are just joining us, the conversation is getting deeper, and as you can tell, Daktari here is helping us understand that most of the people who are suffering from diabetes today, it's not only the elderly like we knew it. The younger population, as young as 15 years, are being diagnosed with this disease, and it's a challenge because then when you are when they prescribe drugs, you have to take them for a long time. So your lifestyle plays a very key role here. So it is important for the parents, if you're watching this, to make sure that your kids are watching along with you. Now, if you have any question for our doctor here, use that number on your screen, and I'm sure it's going to help us understand. Daktari, a lot of people think eating too much sugar is the main cause of diabetes. Can you clarify on that? The relationship between sugar intake and diabetes?
It's a common, allow me to say, a misconception.
Yeah.
Yes, because I think it stems from the fact that it's sugar that is the enemy here. Like your blood is having too much sugar. So the simple thinking is to think that when I take sugar, I'll develop diabetes. So that's not true per se, because as I had alluded, like diabetes, it's from your body not being able to produce insulin. That's what I point. You're not producing the hormone that should be helping you take the glucose, the sugar from your blood to the cells. Yes. The other type is your body just can't use the glucose that is in the body. Basically, you are having resistance to the insulin. Yes, you are producing the insulin, but your body is resistant to it. So that's to mean that your body will sense that you don't have glucose in your body, even though you have so much of it. So it's not right to say that taking so much sugar will cause diabetes, in that as I said, not just carbohydrates, even protein, even fat, you take them, they'll be stored in the body. When you store in the body, in the event that the body needs energy, these are all possible sources of glucose. So even if you take ugali, even if you take let's say rice, protein, let's say beans, even nyama choma, those meat, if in excess, these, you should know that they are all stored in the body, and they are at some point, if needed, will be converted to sugar for your body to use. So it's not just a matter of taking sugar that will cause the diabetes. Everything you take basically is stored in the body, and at some point will be converted to sugar for your body to use as energy. So not taking sugar per se won't prevent diabetes, although lifestyle change and diet control will prevent diabetes, not just taking sugar. You can take, I usually use this example, like a person taking sugar, let's say like 5 spoons of sugar in a day. So you're saying that I won't take these 5 spoons of sugar in a day, but I'll eat this chunk of ugali. That's to me that this ugali you are taking will just go to the body. It will be stored, and at some point will be converted to the same glucose that you are avoiding to take. So like, it's not to say that I will avoid sugar so that I don't take. Even you will find that the sugar you were avoiding to take just a small quantity compared to what you are going to take instead. Yes.
And I like it when you help us understand that food here plays a very important role in contributing to in predisposing someone to diabetes. Maybe walk us through the kind of diet that people should not really give themselves to, and also help us understand how should people eat, because I see you're talking more on around diet. Help us understand the kind of diet that predisposes us to diabetes and the diet that helps us prevent.
So for diet, I can say there's what in layman we'll call junk. So basically junk food is the one that is in excess of calories than the nutrients, the core nutrients that the body needs. You can find that you are taking a meal that is like 70% calories. So basically you are pumping calories into your body while you needed minerals, you needed protein, you needed vitamins at some point. So it's good to note that the excess calories you take will be stored in your body. So when you store so much in your body, you gain weight. You gain weight, you become resistant to the insulin. You become resistant to the insulin, develop diabetes. So basically that's where diet stems in. So it's not like there's a particular diet, but basically any diet in excess of calories, that's a no. Any diet in excess of these, what we call bad fat. So
what do you mean by bad fat?
By that I mean the good and the bad. The good is the one that when it enters the body will be converted to this high density lipoprotein. So basically it's the proteins that are generally doing the cleansing function in your body. But you find that most of these fast foods, they are prepared using the fats that again will just raise your cholesterol levels. So again that will that's what we call like bad fat. Basically they increase the ones that are supposed to be getting in the body,
the low density lipoprotein.
So all those will contribute to issues with hypertension. With hypertension now diabetes can set in.
Okay. And then you brought out something. I know we're going to take a short break. How does hypertension and diabetes connect? Because you find that someone has diabetes and before you know it, he's now having hypertension. You know, someone has hypertension, before you know it, they're diagnosing now diabetes. How do they connect?
I wouldn't say that there's a kind of direct link, but it's true to say that when you find diabetes, likely they'll develop hypertension. Okay, the opposite can also occur, like hypertension leading to diabetes, but the commonest scenario is a diabetes patient developing hypertension. Again, it's good to note that of the metabolic derangements, the changes in the blood vessels that comes with diabetes, they all predispose to hypertension now. Then again, from the other angle now, you are having hypertension. So with hypertension, these are people with time, they'll have this, what we call excess cholesterol, like the bad fat I was talking about. Now, all these are factors that can contribute in developing diabetes. Like
hypertension.
Yes. One is a risk factor for the
other.
Yes.
Thank you so much, Daktari. And I think this is a very interesting conversation. Those of you who are just following us, this program is sponsored by JCK Hospital. And now we have a representative, Dr. Emmanuel, here giving us great information about this disease, diabetes. We have been able to learn that these days it's even diagnosed as early as 15 years. And we've heard about what really predisposes our children to this diabetes. But we are here to find out the real cause and how do we manage, how do we treat, probably eliminate diabetes. We have also been able to identify hypertension in the picture, that if you don't deal with it rightly, those are the people you hear is been diagnosed with diabetes and then hypertension. So we want to understand how do we prevent this condition. And that is something that we want to concentrate on in the second segment of our discussion. But remember, we are also going to be answering all your questions. If you have any question, use that number on your screen. I know Doctor also help us understand how the connection between the idea of diabetes running in families. You know, very many people have this question, the fear that if my mother has diabetes, then it's by default that I may present with it at some point in life. I'm sure you're going to help us understand. So that and much more is coming up in our second segment. Do not change your dial. We are coming back after a short break. Keep it Faith Today Television.
Hi viewers, I come to share good news with you today, and the good news is that I have a new book. My first book actually. This book is called Threads of Destiny, and I say it is in the hands of the Master Weaver. Why did I write this book? It's because after going through many different kind of things in my life, some very painful, traumatic, and also good things that God has done, I realized that in the journey of life, God is like God working, like the weaver works through a basket or doing something with the threads. And I realized that from down here, we see the mess of our lives, we see the failures, we see the pains, but from above, the Master sees the beauty of what He's making out of us. And through my life, I decided it is good to be able to share my story, because as somebody said, every life is a story if we care enough to listen. And so I wrote this book to just be able to bring hope to somebody who may be feeling hopeless, to bring, restoration where there is desperation, and to tell you that God gives a second chance in life, but you must be willing to take that chance. And so I welcome you to order a copy of this book. It is only 1,000 shillings, and or $10 for those who are outside of the country. You can order through the number on the screen, and we'll be able to get you a copy of this book. God bless you as you read it. Give it to somebody else, and I know they will be helped. Amen.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. All right, welcome back once again to Faith Today Television. Today we are talking about diabetes in families. We are talking about the best way to deal with it, and we have an expert in the building, Dr. Emmanuel here from JCK Hospital, giving us great intel. And I know for our viewers out there, I can tell that you are getting value out of it because of the questions that you are sending in. Thank you so much. And I want to remind you as well, as you sending that question, tell us where you are watching from and your name, very important, so we can address you directly. Daktari, before we took a break,
Yes.
there is that very urgent question. Diabetes in families, is it a guarantee? If my parents had diabetes, will I have to manifest with it at a point in life, and help us understand what happens really?
All right. So I had alluded that diabetes is that family history issue.
Yeah.
And just simply put, it's not a guarantee that you'll have diabetes, but now this where it comes from. So it's from genetic predisposition. You have in your family, there's that genetic component running through the lineage that predispose to diabetes. Then it's good to know that diabetes is multifactorial, so that it's not just about the family history, but family history on top of what other factors. These other factors now, that's where you can't control the family history because you are born into it. But these other factors which can contribute to you now developing diabetes, that's where now you have control over. So it's not a guarantee, because even inherited diseases are not a guarantee that you will get. For example, sickle cell, like your mother having sickle doesn't guarantee you 100% you will have sickle cell. So there's that variation, even outside other factors. Already there's a variation. I don't know if we are together. Like there's a variation. Let's say diabetes has no other factors apart from the genetic component.
Yeah.
It's not like 100% now that you have that genetic component,
Yeah.
you'll develop diabetes.
Diabetes.
Because for genetic diseases,
Yeah.
also don't go that way, because there have to be other
Yeah.
issues. So now diabetes are multifactorial. So okay, you have that genetic predisposition, but there are these factors, the risk factors we're talking about, having excess weight.
Yeah.
So family history, now you're having excess weight.
Now. Yeah.
That's another factor. The issues with what we call polycystic ovarian syndrome. So you have a family history of diabetes. Now you're developing polycystic ovarian syndrome.
Yeah.
Now on top of that, you're taking alcohol.
Yeah.
No, so these are factors that are building up on each other.
Yeah.
Towards the same thing, developing diabetes.
The diabetes.
So, yes, I think I've answered it's
Very
not
well.
Yes.
Yeah. And I like it when a medical doctor tells us that it is not a guarantee that if your parents had diabetes, that you also have the diabetes, So it's important that you are aware of what causes the diabetes and what you need to do to prevent it, because there are chances that it could reoccur if you don't take the necessary measures. We call that wisdom, where I come from. And then, Dr. we have so many questions. I know people are getting value from it. I hope that will answer you, our viewers. Stella says, can eating too much sugar directly cause diabetes? I believe we answered that. Stella, I think Stella sent him her question a bit earlier. We're able to answer that. Allow me answer another viewer. Hey, I'm Nemo. I'm from a family where almost everyone has diabetes. What are practical steps we can take as a family to beat this? Almost everyone in the family. What are the practical steps?
Practical steps
to beat diabetes.
So basically to break the family chain. Is that like?
Absolutely. I mean,
all right. So I'll say that in that family there's a very strong genetic component of, I would say, is it type 2? Are they talking about type 2?
I think she didn't specify, but most likely.
Let's go in that direction.
Yeah.
So in that family there is this strong genetic component predisposing to diabetes. And it's good to note that even genetic components build up on each other. So that if your mother side has very strong predisposition to diabetes, your father side has very strong predisposition to diabetes. Now, like even though all those factors now are then adding up, like it becomes even more likely to develop diabetes. But as I had said, like breaking this family chain, like nowadays there are many other factors contributing to the development of diabetes. So I wouldn't say like even like issues with intermarrying or what, because nowadays even without a family history of diabetes you can develop diabetes. So in that family, yes, there's a strong predisposition, but again I will ask, in this family, are there these behaviors? Are these lifestyles that also contribute to the same? That could be a possibility, not just the genetic component. You see, like people who live together tend to eat together, tend to do things almost the same way.
Yeah.
So is there like there are other things contributing to the development of diabetes in this family? So that's one thing, a practical thing to think about and act on. If in this family we largely eat this kind of meals that we know predispose to diabetes, what can we do about it?
And I think that's very important because when you talk about dietary kind of behaviors in homes, that is something that Nemo should do, make time to come and meet you, you understand, and then you're able to help her better, right?
Yes.
GCK Hospital, right?
Yes.
Perfect. Jeff says, is it true that people with diabetes should avoid all fruits because of the sugar content?
I would say not really, because sugar for a diabetic patient can even be a lifesaver. Take this scenario. You are a diabetic patient and suddenly, you see, as I had said, issues with diabetes is your body not being able to take sugar or not producing insulin. So, for example, okay, in this case, patients with diabetes can suddenly go to hypoglycemia, in that, like, your body suddenly doesn't have the glucose. Let's say you are on medication for diabetes. Then you take the medication, then skip a meal. Suddenly your sugars go very low. So in this case, sugar can be your lifesaver. So I wouldn't say that avoiding sugar or fruits is necessary, but it's good to know that these excess sugar fruits can again raise your sugars very high. So that's why we say that we avoid foods that can suddenly cause a glucose surge in your body.
Yeah.
So that will include very sweet fruits, anything very sugary. They can suddenly, even if it's well controlled, they can make your sugar spike because you are not that able to produce insulin to match the quantity of sugar you've taken. Yeah, so basically that's what these fruits. So it's easy to say that I will avoid fruits so that my sugars don't go high. Okay, it's half truth because we know that the sugar per se, if mashed with the insulin, no problem. But if sugar with no mashed insulin, problem.
Yeah.
Yes.
Yeah. All right. Jeff, I hope you get the answer there. Another one says, what's the best way to control diabetes on a tight budget? The medicines are expensive. I can feel this viewer. You know, medicines are expensive. Someone is living on a tight budget. You get the idea.
That's
this is a private setting.
And unfortunately, that's the predicament. That's the issue that most patients have to face. You see, like most of these drugs, as I said, there are a variety of drugs. There are the ones that are cheap. There are the ones that are kind of affordable. There are the ones like, then they're very high-end drugs. Then that comes in like, I have this budget and I have to be treated. What can I do? So it's good to note that even in our setup, there are different medicines to use. And in addition to the medicine, there are things that you can do to help cut on the need for the medicine. You see, if you are diabetic and you've really controlled your diet, your weight, so that the need for, let's say, for drugs, the dosage will likely go. If your sugars are well controlled, no need of taking high-end drugs. So for this viewer, I will advise one, let's first focus on the non-medicine approach.
Yeah.
Focus on make sure your diet is okay. Avoid the foods that can suddenly increase your sugar. Then the excess calories cut. Yes, do something on your weight. Be physically active. Then on top of that, if your sugars are not controlled with that, now the pharmacology part, we usually start with monotherapy. Monotherapy means one drug. We start with one. I think in most practice we use metformin. Metformin is like kind of the commonest and one of the more affordable ones. Yes, so if we can stop it at that point. No need of going to the more expensive drugs. But if you not well controlled, now you have to add, let's say, another drug, let's say dapagliflozin, and that's a drug that can cost even 75 shillings a tablet. Now you have, like you say, your bill is going up because we are not controlling the sugars well.
Yeah. And I think that's a very great answer. In practice, normally, if a drug is not working, they either change it or they add on a drug, just so you can have a great result from it. So you realize the ones that the alternatives are using are a bit more expensive. If they're adding on, now that's an extra bill. But you can, like doctor said, you can all reduce or maintain this if you are managing your sugar levels well, you are doing your exercise, you are eating right, doing the non-pharmacological management like he has put. So it's very important that you are watchful. We have John here. John says, Doctor, does stress cause diabetes? And if so, how can we manage it better in today's busy life? This is John.
I will tend to say that he's pointing towards psychological stress. Yes, there is physical stress, emotional, and psychological stress. So I will tend to mean he's meaning the psychological stress, maybe due to everything going on around cost of living and everything, right? Yeah, so psychological stress, I will say it can contribute, but maybe in this way. If you are stressed, basically you are kind of depressed. Depression now will lower your activity level. Yes, you tend to eat non-healthy food when you're stressed. So all those are factors that when you look, they can contribute to development of diabetes. Not to say that there is a direct link like stress will lead to diabetes, but now the events that can occur in a stressed person, those are, you can see that you're not even taking time to prepare healthy meals, not taking time to exercise. Yeah, so basically, like, those are issues that can lead to diabetes. Yes.
Yeah. So how do you help that kind of person?
So here we deal with the main issue. The main issue here is stress.
Yeah.
What can we do about the stress? We need to know what's causing the stress.
Yeah.
Is it financial issues? Is it emotional issues?
Yeah.
And I think those are issues that once we know this is the cause of the stress, now we can approach it from there.
Okay.
Yes, some things can need a psychologist, some things can just need someone to share things with them. And some can need even financial support.
Yeah.
Yeah. So,
and I think that is something that you can do with them when they approach you. I mean, coming to the doctor.
Yes.
John, I think this is a very important question. I also recommend that you talk to the doctors. Make time to go to JCK hospital or any other nearby hospital around you so that you can get the cause. Because I realize in our setting, African setting, most people just really treat symptoms. They don't mind about getting to the real cause. And that is why people are suffering. Some people are on drugs they should not be taking today, and it's affecting. But I want to thank God for the Healthy You program, because it helps us now understand the right thing to do. Even the scriptures say, my people perish because of lack of knowledge. So it's important that you get the knowledge and get better. We have another question coming in. Do children who are overweight automatically have a higher chance of getting diabetes?
I would say not 100%.
Yeah.
Yes, again, it all stems from the fact that diabetes is a multifactorial disease. In that you have, it's not just one factor. I think you can just walk around and see so many overweight people who are not diabetic. It's not to say that being overweight won't cause, it's not a risk for diabetes, but it has to have other factors coming to play. You can be overweight, yes, and you live all your life, no other issues, because there are no other factors contributing to development of diabetes. And it's good to note that the weight, how a person will respond to weight gain differs from different people. Like you can add like 20 kgs. For you, that's enough to trigger diabetes.
Yeah.
Another one will need to add much more.
Yeah.
So like people's bodies are different.
We respond differently.
Yes, we respond differently.
Yeah.
So it's, I wouldn't say that now that your child is overweight,
Yeah.
will automatically develop diabetes, but it's good to know that being overweight is a risk. Being a risk factor is not 100%
Guaranteed.
cause, but it can contribute. Yes.
Right. Thank you so much, Dr. Ali. That is very profound. We have Jen. Jen is saying, my husband has been told he's pre-diabetic. Does that mean he's definitely going to get diabetes?
Not so. But again, prediabetes is it's the situation that just the event that occurs before diabetes develops. So basically, these are people who have uncontrolled sugars. So your sugars are high, but not so high to be diagnosed as diabetes, but they are in there playing. So this is where like you can really do much for yourself so that you don't develop diabetes. Now the lifestyle changes, the diet control, the exercise control, taking care of what you take. If you're alcoholic, you stop kabisa. So that's the point that we say, like you have like a window to change what's about to happen. So well controlled, you might not lead to diabetes. But unfortunately, most pre-diabetics end up in diabetes because one, they are not early diagnosed early. Two, now being adherent to what's required to prevent. Now it's a big, because now you have to change your lifestyle suddenly. Yeah. So it's not an automatic, but now if not managed well, it leads diabetes.
Okay. And okay, questions are many today, and I know that our viewers are getting the juice out of it. I have Anne here. Anne, nice topic. Thank you. How much water should a diabetic person drink daily? Does dehydration affect sugar levels?
I would say what we take, there's a difference in taking water and your sugar control, but uncontrolled sugars will definitely lead to dehydration. So I will approach it this way. It's good to take enough water. By enough water, I mean if your sugars are well controlled, no complication, 8 glasses a day. But now we see if your sugars are persistently high. So if your sugar is high, your body will automatically be dehydrated. Now you see in that event, the water need for your body is high because basically you are deficient of water. So if you are, for example, those who come with complications now, sugars are 30. So these are people like, even if you tell them to take how much water, you will be enough. We'll have to do intravenous infusion of fluids so that it goes directly into the bloodstream to help with the dehydration part and even lowering the sugars. So a diabetic, if well controlled, just enough water, 8 glasses a day with the supplements, fluid diet, that's enough. No need to take excess water if you're diabetic. But if you find yourself, you're excessively thirsty, that will mean your sugars are likely not controlled, they're likely high. So that's why your body is signaling that you need to take more water.
Yeah.
Yes.
All right. I know we are going to be concluding this discussion. And for our viewers, thank you so much for tuning in. I see very many questions coming in. Someone is asking about the connection between diabetes and kidney problems. This is Lynette in Ruiru.
Yes, connection between diabetes
and kidney disease. Yeah.
Now there is a direct link because there are changes that occur in your kidneys now due to persistent high sugars. I wouldn't go to the pathophysiology of it, but it's good to know that once your sugars are persistently high over a duration of time, it causes changes in your kidneys, so that your kidneys are not able to function, the filtering process, yes, and the reabsorption of what's supposed to be reabsorbed from the kidneys. Now all that process will be going to be affected, and it's again good to note that it's not like a one-time event. It's something that progresses with time. It takes time to develop from stage 1 to stage 5 of kidney disease. So now this will stem to a good sugar control, whether pharmacological or non-pharmacological, is the first step to prevent now the chronic kidney issues. Not just the kidneys. It's good to note that even your heart, yes, your eyes, your brain, and even the nerves. Nerves are the issues now. If affected, you develop limbs that are having wounds that difficult to manage. Some are even being amputated. So it all stems from having too much sugar.
Too much sugars
over a long time. Yes.
I mean, things that are not controlled. If you have not controlled your sugars, your kidneys are at risk.
Yes.
The heart is at risk. The eyes at risk. You know, so many parts in the body. The brain is at risk.
It's good to know that diabetes will affect almost all the organs in the body. So, yes.
That's quite interesting. And Daktari, just in a few seconds, kindly give us your parting shots, your one message that this our viewer should get today in order to deal with diabetes.
So, my main point is you need to, if you have any of those risk factors, number one is to get regular screening. I think that's the first point, to get an early diagnosis and an early treatment before complications occur. Number two, it's good to have proper information from the word go, so that if you are to start on medication or different treatment modalities, you don't default, because understanding again is the main issue. Yes, but again, diabetes well controlled can lead to this hope, like can lead to just a normal life as long as you are compliant to the treatment.
Wow. Thank you so much, Dr. Emmanuel. This has been a very interesting conversation. I am sure our viewers have learned a lot. Yeah, that is all about diabetes. If you control it so well, you can deal with it, you can eliminate it in your family, and it is not a guarantee that if your parents had diabetes, you will also get this diabetes. Do the screening. We get these chances. Jessica Hospital does these medical outreaches. You've found tents where people are doing tests. It's important to do a test and understand how your body is operating, so that you can eliminate, get to deal with diabetes before it presents badly in your body. And of course, I know there are those of you who follow us, you are in hospital and you are receiving any form of treatment. We believe that doctors are an extension of God's healing hand, and we pray that may your healing come forth speedily. May God give the doctors wisdom to find out what you're really struggling with and prescribe the right medication to help you through. And we know that you are going to be well in Jesus' mighty name. Again, until we meet next time, my name is Enock Kitondekijja. This is the Healthy You Show on Faith Day Television. Stay proactive. Doctor said stay informed and stay healthy. God bless you.
This is a hospital in Roysambo along Lumumba Drive. We are level 4 facility, SHA accredited.